We've all experienced that unsettling feeling when something seems off with our bodies. Perhaps a fleeting pain here, a strange symptom there. These moments of unease can be unnerving, but most of the time we convince ourselves that it's nothing to worry about. Just some indigestion or stress getting to us. However, what if these seemingly insignificant sensations are actually warning signs of something much more sinister lurking beneath the surface? What if the silent ache in your stomach isn't just indigestion, but a deadly tumor quietly growing in your stomach lining? Welcome to our channel, where today we'll be discussing a rare, yet serious form of cancer that often goes unnoticed until it is too late. So make sure to watch till the end to find out what you can do to protect yourself against this silent killer. Adenocarcinoma, rarely talked about, often diagnosed too late. Today, we uncover the hidden cancer that thrives in silence, destroys from within, and takes thousands of lives each year. But first, let's answer the most important question. What is adenocarcinoma? Adenocarcinoma is the most common type of stomach cancer. It originates in the glandular cells in the stomach lining that produce mucus and digestive enzymes. When these cells mutate, they can begin to multiply abnormally, forming tumors that eat away at the stomach wall. This process is often slow, taking years to decades to develop. But the problem is that in its early stages, it can be difficult to detect. Why is it called the silent killer? As the cancer develops, it can cause symptoms like indigestion, bloating, and mild nausea, which are often dismissed as problems with gastritis or ulcers. By the time the symptoms become obvious, such as weight loss, vomiting, blood, or difficulty swallowing, the disease has usually spread to other parts of the body. We'll show you a patient case study later on to demonstrate how many people mistake their symptoms for something less serious until it is too late. Who is at risk of developing this type of cancer? Several factors can increase a person's risk, including infection with the Helicobacter pylori bacteria, a bacterium that causes inflammation of the stomach lining, a high-salt diet, a diet high in processed and smoked foods, such as sausages and bacon, as well as a family history of stomach cancer or certain rare genetic syndromes. Additionally, smoking and heavy alcohol consumption can also play a role. However, it's important to note that only 5% of cases can be attributed to these factors, suggesting that many cases occur in people without these typical risk factors. Now, let's take a deeper dive into the science behind how the tumor grows and spreads. Once precancerous changes occur in the stomach lining, it can take up to 10 years for the condition to progress to dysplasia. This is a condition where the cells in the stomach lining become abnormal and out of control. If left untreated, dysplasia can lead to invasive adenocarcinoma. At this stage, the cancer cells have spread through the walls of the stomach and into nearby tissues and organs. It typically spreads to the lymph nodes, liver, and lungs. Now imagine this happening inside your own stomach. What if your stomach lining is hiding cancer right now and you wouldn't even know it? That's why it's crucial to be aware of the symptoms and risk factors. How is adenocarcinoma diagnosed? Adenocarcinoma is diagnosed using an upper endoscopy and biopsy of the stomach lining. Other tests, such as CT scans, can help determine whether the cancer has spread to other parts of the body. Early detection is key because it means that the cancer is still confined to the stomach and has not spread elsewhere. However, people often don't seek medical attention until the symptoms become more severe, which means that by the time the diagnosis is made, the cancer may already have spread. This is one of the reasons why it's so important to talk about these symptoms and not ignore them. There are various treatments available for adenocarcinoma, including surgery to remove part or all of the stomach, as well as chemotherapy and radiation therapy. Newer targeted therapies such as HER2 inhibitors and PD-L1 inhibitors have shown promise in treating certain types of adenocarcinoma. These treatments aim to specifically target the cancer cells while minimizing damage to healthy cells. To learn more about these treatments and to hear inspiring stories of survivors, stay tuned for more updates. In the next chapter, we'll discuss ways to prevent and reduce the risk of developing adenocarcinoma, as well as steps to take if you think you might be at risk. Remember, knowledge is power, and understanding the risk factors and symptoms of this disease can help you take control of your health and well-being. Until next time, stay healthy, stay informed, and stay hopeful. Goodbye.